technical assistance and grants management. So as the CEO for N4A, Sandy is responsible for N4A's overall management. She sets strategic direction for the staff, oversees the implementation of all policy, grassroots advocacy, membership, and program initiatives. I've been a AAA director for about 5 years now, but I've known about Sandy for many, many years. And even before I was working as a AAA director, when I was working in Alaska in our aging services, we turned to N4A for guidance. We knew that N4A is the one that had the voice about aging services. So it really is my pleasure to introduce Sandy Markwood today. She's going to work with us for an hour today, and then we're going to hear again from her this afternoon. So Sandy.
Great. Linda, thank you. Thank you all so much for having me here. I have to say that it is truly an honor and a pleasure. And as I was driving up here from Denver, I am amazed at the beauty of your state. And thank you for orchestrating the weather, because it's just, I was just out taking pictures, sending them home, going, it is so pretty here. But I won't move here because I know that that's another issue that you have. I live here, but I'll come back and visit whenever you want me to.
She's aiming for spring.
Yeah. Well, I was actually here for less than 24 hours last week, and I saw fall, and now I'm seeing winter, so I'm moving back to spring. And I'm really amazed that you can put the seasons together that quickly. But it really is a pleasure to be here, and I really want to recognize and honor all of the area agency and their staffs that are in the room. I also want to thank our new board members, both Eva, Vetch, and then also Linda Meyer has come on to our board. I also want to recognize Eva Jewell, who is on our board for a very long time, and my friend Courtney from ACL. It's you have an incredible network here, just incredible. And I think coming together and looking at the future of this network, I'm just really impressed, and am hoping that other states, both with their state unit, with their ACL regional offices, with their governmental, the governor's commissions, and the area agencies and providers come together to do the same thing, because I think we're in a really critical time, and that's kind of what I wanted to use my hour to talk to you about, is really what I see as the new directions in aging, a little bit from the policy side, but also really from the programmatic side, and emerging trends, which I hope dovetail with the incredible presentation you just heard about data. Because what I'm looking at and what I'm hearing as I get the opportunity to go across the country and work with the federal agencies, and also have interface with the state units on aging. As Todd knows, we also work very closely with the National Association of States United for Aging and Disability, all the state units across the country, is really that we are in a kind of a watershed moment. So this planning that you're doing here today and have been doing is really critical to be able to ensure that we really are forging the future of aging here in this nation. So in saying that, I'm going to run through some slides. And let me see. I did it. Our business has always been, from the creation of the Older Americans Act, what we do, what all of you have invested in and are committed to, is really ensuring that we are helping people age successfully with dignity and independence. I say that, and I begin almost all of the presentations I do, because that is what grounds us. That is, when you look at that data, that's what drives us into what we need to focus in on. And I would have to say that we have a 40-year track record plus of success. Now, Dave worked for 44 years in the area agency, so he was part of this track record of success for many, many years. But in saying that, everything that we've done to this point, everything you've done to this point, you've done really well, and sometimes with very limited resources. But I think the discussion that you're having today is really looking at the fact that times are changing, right? Now, I put this up here. How how many of you have ever been to a Bob Dylan concert? Just a few. Okay. I went to a Bob Dylan concert recently. I mean, I grew up, I'm a baby boomer, and Bob Dylan was kind of my icon as I was growing up in my teenage years and beyond. And I took my kids to this Bob Dylan concert, and actually they wanted to go, which surprised me. So we heard it at home all the time. Well, they did. But let me tell you, Jayla, so we were sitting outside, not in a venue as beautiful as your Red Rocks, but in an area outside of DC called Wolf Trap. And we were all excited, we're sitting on the lawn, and Bob Dylan comes out to sing. And I couldn't understand a word he said. Not a word! And to make it worse, he didn't sing any of his old songs that you and I might know. I don't know what he was singing. So I'm sitting here with my kids who go, well, Mom, he's one of your clients now. I said, okay, you're right. So the times are changing, and who we're serving, and what they want, and what they need is certainly changing too. And you see all of this. You see all of this, the discussions about, the new science of aging. And there are a lot of new developments. The discussion we just had about how many older adults are using the internet. I have to say, that data is really important. I was just at a meeting of like 5 national universities who are competing for an NIH grant, and they were discussing what older adults need, and they were sitting in the room saying, they don't use a smartphone. Oh, they don't use the internet. And they were projecting out needs for 10 years. And I was sitting there at the table, and they people in their 60s. And I said, wait a minute, I'm in my 60s, and I use the smartphone. So I say that in the fact that you all have to be out there talking about what the real needs of people who are 60, 70, 80, 90, and 100 are, and what the real needs of their caregivers are. And as we talk about those needs, recognizing that you also are in a very dynamic position, because when we're talking about service delivery in the aging network, it's not one generation of older adults. It's multiple generations of older adults. We're talking about the silent generation. And, that is one group. When you're talking about baby boomers, it depends on what decade you were in, right? And the same thing with caregivers. So I say that this really is a complexity that we as an aging network really need to face. And the other reality of that is that what we do and how we do it is going to change. And we have to be open to that. Now, I am reading, as you probably are, a lot of things about robots. And I personally don't want a robot in my home. And I don't want them, but they could probably cook better than me. But I don't want them there right now. But that may change over time, and it may need to because of the workforce issues. And I say that because as we really, as an aging network, need to embrace technology and the opportunities that are there, and recognize that there are studies that show that it can be very effective. It's not a matter of replacing the human touch of what you do. It's a matter of looking at how best to augment what you do and to use it well to be able to meet people's needs over time. Because the numbers are growing, the complexity of the needs of older adults are growing, and they're really challenges. And so how do we blend technology with that human touch that makes a difference in people's lives? And the fact that this aging network has been the trusted resource for older adults and their caregivers now for multiple decades. Now, we raised the issue in the last session about sometimes people don't connect to you until they're in crisis. They don't go looking for you until they're in crisis. And so it's also that balancing act of how we make ourselves available and make ourselves available both on a prevention side as well as being at the right time and the right place with the right resources when people are in those crisis situations. So as we look at what the future may have, we need to recognize that the landscape is changing. The landscape of older adults and what they need are changing. the landscape of what communities are changing, and the landscape of the workforce is changing, and the landscape of what we do to respond to all of those challenges and changing needs to align as well. So when we look at that, we need to recognize that there are key factors, and I just wanted to highlight a number of those. And I do think that they kind of interrelate really well with the data that was just presented. But as I see where the aging network is going in the future, these are some of the key areas that I see are critical and important. One is being a bridge between healthcare and aging services. And you heard a lot in that data about the need to connect. And I know from N4A's perspective, for those of you who have been at N4A conferences, we've really been pushing the opportunity here for the blending and the bridge between the healthcare community, the acute care health community, what happens in the hospital, what happens in the doctor's office, and what happens and where the needs are really. Where does most health happen? It happens at home. It happens in the community. And now the healthcare community is recognizing that with all of these discussions about the social determinants of health. In Washington, you know that an issue has really made it to the top when it gets its own acronym. So SDOH. So when you see that, social determinants of health, I know what that is. But you know what those social determinants of health are? They're what you do and what you've done for decades. So recognizing that that's a key issue. Living with chronic conditions, and we all know that as people age, they will get chronic conditions. And we will try very hard through prevention, nutrition, and physical activity to be able to both try to prevent those for as long as possible, but ultimately that is right now part of the aging process. So the question is, what is our role as an aging network in helping people live well and manage their chronic conditions? Living with dementia, that was raised, and it's certainly an issue that I want to go back to, but it's an issue that is going to impact every community that you represent in this room. Because the numbers of people who are living with dementia are increasing, and also the issue there becomes not only the numbers of people, I'm sorry, because I know you guys can't see, the numbers of people.
Bob's so damn tall.
Did you completely, if you move over here, you can completely. So, but currently, the estimate is 60% of people who have Alzheimer's and dementia are living in the community. I think that is terribly underrepresented because the other issue that we still have going on is people aren't getting a diagnosis of Alzheimer's and dementia because there's not a cure. Also, living with serious illness, and the reason why I was here last week for less than 24 hours was to be able to participate in a plenary session at the CTAC conference, which is the Coalition to Transform Advanced Care. Basically, those are people, I know, I always just like, please remember all the words. This is a whole different area. But when you look at dementia and you look at people who are living in the community with serious illness, defined as probably the last 12 months of their life, and for people who that there really isn't anything that they can do to prevent the illness. It's a matter of helping to keep them comfortable for that last 12 months.
You know the exciting thing though is that you were invited there.
I was
got the network.
They were, and I can't tell you, there were probably, I've gotten 20 some emails from healthcare people afterwards saying, I didn't know about your network, and I want to learn more. So you've got an opportunity to connect with people in this area, but quite honestly, you're serving people with dementia. You're serving people who have serious illness. You may not define it as such, but I'm here to say as we move forward with the Aging Network, we need to put our stake in the ground of the types of people that we are really serving. Because I think not only is that an opportunity to grow the Older Americans Act, to grow our healthcare partnerships, but there actually may be new money in Washington, D.C. around some of these issues. the issue of social isolation that just came up in our data discussion, and the recognition that that's a public health issue. So, like social determinants of health, well now social isolation, engaging older adults is considered an important health issue. And you play a pivotal role both in identifying people who are socially isolated. Why? Because you are invited into their home. But also, because of that important relationship, you have an opportunity to look at ways to engage them. And then the last issue is caregiving, which you all have played and continue to play a really important role in. So I just wanted to highlight a little bit of those issues in a little bit more detail. So on that issue of building the bridge between the acute care health world and the world that you live in of aging and where your clients live, which is at home and in the community, if you don't have this study, please download it and keep it at your desk. And every time you meet with a healthcare provider, just kind of have it, just put it on the table. Because it's an amazing study. It was done by the Robert Wood Johnson Foundation. It's called Healthcare's Blind Side, the overlooked connection between social needs and good health. Again, this really builds on that importance of the social determinants of health. But the numbers here are low, but pretty incredible. What was in that survey, and they surveyed 1,000 physicians. So again, recognizing the numbers were low. But what these physicians said, pretty amazing. 85% say unmet social needs directly lead to worse health. 85% say social needs are as important to address as medical conditions. 80% are not confident in their ability to address social needs, and I would say, nor should they address social needs, given the fact that most primary care physicians have 15 minutes with a patient. They need to focus on the medical needs. We can focus on the social needs, right? 76% wish that the healthcare system would cover the costs associated with connecting patients to social needs. We want that as well, right? But we want to be paid for that. So building the connections there, again, that bridge between healthcare and aging services and other social services to make that happen. Recognizing that the money is really in CMS. ACL has done a wonderful job in building that bridge with the Centers for Medicare and Medicaid Services, but we really need some legislative changes to be able to make that happen. And finally, doctors would like to be able, 1 in 7 said that they would like to be able to write a prescription for social needs. So this is
some that are.
And there are some that are. And how can we be part of that equation? And to the bullet above that, get paid for that. How can we be part of that equation? Because that will really impact those important health and wellness needs that came out in the data. So the social determinants of health are in here, but as you look at these, again, it's recognizing that medical care is 10% of the social determinants of health. Behavioral, personal behaviors that you impact and serve, environment and social, which goes to the design issues. So it's medical care and genetics are 40%. The other parts of community interaction and personal behaviors are the greatest part of the social determinants of health. So how can we put our stake in that? How can we put our stake in how the social determinants impact economic stability, which came out in the data, neighborhood and physical environment came out in your data, education, information that we need to give people about services and supports and how they can take better care of themselves, food and food insecurity, community and social context, which is that whole issue of social integration and social systems and supports, and again, how that integrates with the healthcare community. Recognizing that this all integrates with healthcare. We're not trying to take over the role of the doc, but how can we help support people in their health and wellness and in collaboration with the medical community. So as we look at the population that we're going to be serving, and the healthcare community is going to be serving moving forward, just a couple of gauge points, and you all know most of this. But when you look at the characteristics of the Medicare population, you know, chronic conditions huge, 66%. Income is an issue, came out in the data that you have 50% who are living below $25,000. You know, and it sounds like you may be better in so many parts of Colorado than that, but still it's an issue. Savings, lower. I'm a baby boomer. I am appalled at the savings statistics of baby boomers. This is going to play out over time, and it's not going to play out well. Cognitive mental impairment, you could go all the way down here. But this really shows these are the people and the needs that you are currently being asked to address, and you are going to be asked to address to an even greater extent as the population of older adults continues to grow. And living with chronic conditions is a reality. And through evidence-based programs is one way to address that, and the network is doing that. But how else can we address people who are living with chronic conditions at home in the community, and to be able to meet their needs while they're living there, and their caregivers' needs? Because as the number of chronic conditions increases, so do the caregiver needs that are associated with those, right? So this is a really critical area. And then also recognizing with that chronic conditions is the correlation, again, with the healthcare community on the fact that those people who have more chronic conditions maybe are looking and costing the system more money. So as there's a lot of discussions in the newspaper about, you know, the deficit in this country, and recognizing that we need to address that, but at the same time looking at the commitment that the nation has made to the Medicare program, and the commitment that the nation and states have made to the Medicaid program. So how can we utilize our costs, our resources as well as possible to be able to address the needs of people with real serious illnesses in the best way possible, and I would also say in the way that they would prefer, which is looking at supporting them living at home and in the community. So again, this is a space that you're in, and I think it's a space that the Aging Network really needs to grab hold of. The other areas I mentioned is dementia, and you can find Colorado on that map, but when you look at that entire map, it is a little daunting. I had the privilege of being at the Alzheimer's International Conference that was in Chicago in July. And I was put on a panel, it was this evening plenary with all of these scientists that were doing research in Alzheimer's. And talk about feeling like a fish out of water. I took chemistry and biology and all that stuff. I did not know what they were talking about. But I was impressed. But in saying that, so then after all of these scientific discussions, they asked me to get up and talk about what's going on in the community. And I talked about the work that you do. And I also talked about Dementia Friendly America, which is a new initiative that N4A is administering, which is really an overlay to the work that's going on across the country with Age Friendly. And we are working with AARP on trying to synergize those two, and knowing that Larimer County and other communities here in Colorado and across the country are really delving into this. But in looking at helping people increase living with dementia, in that room with all of those scientists, and there were like 200 of them, they came up to me afterwards and they said, "Thank you." I didn't think I did that good of a presentation, but it was great. But no, they said, "Thank you for the work that your members are doing." Because when we're looking at finding a cure for Alzheimer's, we're years away. We may be decades away. And when we do find that cure, it's going to be targeted to people who are in their 30s, their 40s, and maybe their 50s. So there will be people living at home and in the community with Alzheimer's and other dementias for many years to come. What they said to me is, it's easier for me to go to bed at night knowing that there are people like your members that are out there helping people live as well as they can at home in the community with this disease. So I want to translate that thank you over to you because you're the ones that deserve it. But in saying that, again, I think when we recognize the numbers of people that you all are serving that have Alzheimer's and dementia, the number of caregivers that you're serving, there's real opportunity here for us to state that. And the Alzheimer's Association, they do great work, and they're a partner with us in Dementia Friendly America, but they don't provide a meal. They don't take people to the medical appointments. That's your space, and they recognize it. Wade, did you have a question?
Yeah, that's not a very age-friendly slide. I can't tell what the...
I'm sorry. It's Bob's head. How do you know? I'm sorry. So as we're looking, you all are in the 50 to 80.3% projected changes. No, I'm sorry, 40 to 49% projected change.
What's going on out west?
So that was a question that I had. So what is going on out west? Because this is pretty dramatic. I mean, we usually see in the South, I would say, because of income and poverty issues, but what's going on in the West? And those are issues that we would like to delve into as well. So yeah, when you're looking at 40 to 50% of the change, that's pretty big. So what it says is projected changes between 2014 and 2025. So those are the projected changes.
Number of people with a diagnosis.
Mm-hmm. So in saying that, I will provide all of these slides to you. So they, I'll send them to Linda so you get them, because I know some of them are difficult to see. Go ahead.
Wade, I'm going to give you some stats. My day job is the Colorado Regional Director for the Alzheimer's Association.
Great.
So I'll throw this out. A big part of some of those increases is education. Not just education in the communities, but education with service providers, education with doctors, more realization and more sensitivity to the issues. Right now in Colorado, we have 71,000 diagnosed folks and a little over 240,000 caregivers, unpaid caregivers for those folks living with Alzheimer's and dementia. So that's a big part of the increases that we're seeing state specific. I can't answer to the rest of the regions, but that's a big part of what we're seeing in Colorado.
Yeah, thank you. And the Alzheimer's Association does amazing work. We're so pleased to be partnering with you all. But this is going to take a lot of people to be able to respond to the needs of people who are living with Alzheimer's and dementia at the community level. And again, these are some of the statistics. The 60% of people living in the community, 85% of caregivers are providing the maximum amount of care. The impact on businesses, talking about the economics of aging, huge impact on businesses, primarily with caregivers, and also the impact from paying for the level of health care. And certainly we want to do that, but we want to be able to ensure that we're providing the most appropriate health care. So, dementia is a big issue. But also, the issue of living with serious illness. And when you look at the healthcare spending, not only for the last 12 months of life, but the last 6 months of life, I mean, everybody is always talking about, how much we spend on older adults, but really, when you really track the numbers, it's not significantly higher until you get to that last part of the last 12 months. And the last 6 months, it almost goes straight up. Part of that is because of the lack of discussion around this important issue. We focus so much about ensuring that we live well, and as we should. But I would say in the future, as we move forward as a society, and I would say there's a role for the AG Network, is we need to have the realistic discussions that none of us are going to live forever. And we need to have discussions with our families about our advanced directives and living well, but we also want to die well. And I know that that's hard, but what I'm seeing is a lot of discussion in Washington around this issue, but also this desire to set up a whole new system to be able to respond to that, with social workers taking the lead. And I'm sitting there saying, what? You've got a network of people who are trusted at the community level, who have social workers and medical workers. You don't need to set up another system. It is an opportunity, I think, for the aging network moving forward. And especially when you look, this was a from the Kaiser Family Foundation that did a survey of people, caregivers and people who are living with advanced illness. And this is what they said that they need. The family members needed help. What kind of help that they needed? Transportation, help with everyday activities, coordinated care, managing finances. And then this last one is really an issue around caregiving in general, which is managing nursing tasks, because we know caregivers are doing that more and more. But when we look at this, again, this is your sweet spot. This is what you do every day. This is really a part of your service plan. And then in looking at the issue of social isolation, I am so glad that this is coming to the forefront. And we are in part of leading a national resource center on the engagement of older adults, bringing in researchers to be able to help you all elevate this issue at the local level. But again, being lonely, being socially isolated, and they are actually two different things, but is now attributed to being as bad as smoking 15 cigarettes a day. The incidence of functional disabilities increases by 57%, I believe, when you are socially isolated, for people who are socially isolated, and mortality increases by 47%. So this is a real issue for older adults. It's also a real issue for people in the 18 to 24 age group. So there's a huge opportunity here for this aging network to work with youth and to create intergenerational programming. And in looking at it, there's a huge cost. This is from AARP's work, and we're pleased to be working with them on their Connect to Effect program. But social isolation costing the National Medicare program $6.7 billion a year. I mean, that's big. And again, it really shows the impact that I think this network can have on trying to help people. So the issue of caregiving, which you work in and have worked in even before the National Family Caregiver Support Program, let's be honest. But in looking at that, it's an issue. And I was interested in the data on the caregiving because currently for people who are 80 plus, there are 5 caregivers to be able to assist them. By 2050, there will be 3. What does that mean? That means that more of those people will be looking and turning to your services and supports because the family caregiver will not be there. Or they'll have to, or will be looking at ways to incentivize other types of caregivers to help play those roles. So this is important. It's a little daunting, I agree. But the other issue on caregivers is looking at who's caregiving and the demands on their time. And particularly when you look at those people who are 75 plus, who are spending almost 35 hours a week doing caregiving, people is 65 to 74, 30 hours a week. So once those people go away, or once those people who are caregivers need caregiving themselves, you can see that we are really creating a perfect storm in this environment of people who need help, people who are caring, and ultimately carers who are going to need help, which really gives us the opportunity, as you all are planning for the future and looking at the data and looking at how you develop your plans of how you develop the next business case. And I know some people go business case, but we're nonprofits, we're part of county governments. But you know what? In this day and age, both politically and also looking at it from an economics perspective, that's how we need to sell ourselves. I come from DC. I have to admit I was born there. So you can really feel sorry for me. But in saying that, when you go into a congressional office or when you go to the state legislature or Wade's talking to the governor, the stories are wonderful and everybody knows the great work you do. but you have to back it up with the data. You have to back it up with the value proposition. You have to back it up with the return on investment. And I think in all of these areas, and with the great work you do, you have the ability to do that. And you're going to need that ability to create more opportunities for funding. Here in Colorado, you've gotten a lot of great state support, and I hope that continues. On the federal side, we've been able to maintain, and we've had a couple of increases, but not enough to be able to meet the needs of your current population of older adults and caregivers, and certainly looking at the future. So, you know, as you look at that green line, you can see, you know, more of the standard funding sources. But this bottom line is where area agencies on aging are going out looking at transportation, looking at veterans programs, but also looking at healthcare providers as a way to diversify their funding and be able to meet their mission by serving more and more older adults and caregivers. So this is all key and critical, and N4A has an Aging and Disability Business Institute, which is there to help any area agency or provider that's interested. And I just highlight is that certain areas there's more interest, like care transitions, healthcare providers, you know, most of the funding, 27% was coming from healthcare providers. Case management, not so much, but still they're on the board. Assessments, mostly Medicaid, but cost share, private pay. And then when you look at medical transportation, you know, there is growing push for other diversity of funding sources in there. And this is really a realization that's coming about both on the healthcare side as well as our side, which that there needs to be cross-sectional partnerships to be able to do this work, to be able to help meet people's needs. And area agencies on aging need to be part of those cross-sectional partnerships. So the fact that you all are noted, and there's articles in Health Affairs talking about area agencies and also talking about what's going on with the state units on aging, this is kind of exciting new territory. It's also very difficult, it's very challenging, I am not going to deny that, but it's new opportunities as you're looking at planning for the future of aging here in Colorado. And in saying that, there are businesses looking in this space too. This is a report, and I apologize because I actually took a picture of it on my bed. On the cover of this book. You know, I am so high tech. I mean, really, my son and daughter would just be mortified. But this is KPMG came out with investing in social services as a core strategy for healthcare organizations developing the business case. What does this mean? This means that there are other people looking at doing what you're doing, and they're looking at it to get other dollars to do what you're doing. And again, I keep going back as your advocate for this network is you are the best people to do it. If you have the resources, you have to have the dollars to be able to do it. So, so these are opportunities. And again,
Could you read that title again?
sure, I can. I can go back. And again, you're going to get all of these slides. It's investing in social services as a core strategy to healthcare organizations developing the business case. Okay? And again, I can even give you the link when I send the slides. So again, Health Affairs. Healthcare and community-based organizations have finally begun to partner to integrate health and long-term care. So I think it's kind of our moment in the sun to be able to move in this direction. It will take data, it will take partnerships, it will take work. I am not denying that. But the ultimate goal is on that data on health and wellness. It can, I think, not only bend a cost curve, it'll also bend an outcome and improve those factors for the people that you care about. And in saying that, I'm just going to run through this quickly. It's already happening. We did a survey of area agencies on aging, and 41% have one or more contracts. So it is happening. It's hard, but there's work going on in that regard, and these are some of the activities that are being contracted for: managed care, primarily being the driver, case management, care transitions, care coordination. I was surprised that evidence-based programs was low on that, but you know, evidence-based programs take a while to be able to get the results, and sometimes the healthcare providers don't. They need more immediate results for that to show the ROI, the return on investment. And then again, these are the organizations that are contracting managed care, but also hospitals and health systems. And we're seeing actually more commercial plans looking at wanting to contract with area agencies on aging too. So there's lots of developments. And then more AAAs that are interested in it. But I say this every time I bring these slides out. This does not mean that every AAA in this room could, should, or would need to be able to do that level of contracting. In most parts of the country, the area agencies are doing it through the development of networks. To both be able to coordinate, to highlight the strengths, and also to diminish any weaknesses, and also because you cover a broad geographic area. So again, as you think of moving forward in some of these areas, as you look at planning for the future, recognize there's some things that each individual AAA may want to do, but there's some things that the network of AAAs, either regionally or statewide, want to do, and that's what we're seeing across the country, and these are some of the highlights of networks that have already been developed. So in looking at that really quickly, and I'm just going to check my time, because I also wanted to take some questions. There are also other factors that I see out there as if those weren't enough, right? Responding to competition, partnerships, consistency, embracing diversity, and that important issue that Wade brought up this morning, which is workforce issues, and how we're going to tackle those issues moving forward. On the competition side, I always look at competition as one way. I don't want you all to be usurped by new organizations coming in who don't know the network. We've seen that somewhat with healthcare when in those states that went to managed care early on, that they decided to build rather than buy. It didn't take many of them long to go, I don't know how to deal with this population. So again, I think there's competition here, but part of that is developing the right partnerships to be able to encourage people to work with you, either on a contractual basis or at least on a partner basis, around all of the issues that I highlighted. The other issue that's coming up, and there's discussions at ACL, and there are discussions at the N4A board, and I think there's even discussions, Todd, within the state units on aging, is looking at quality standards and consistency across the network. That's not to take away from local flexibility, but it's to say that if we call case management, one thing in Larimer County, it should be the same thing in Denver. And that positions you so that if you get funding from other sources, that we're talking about the same type of services and supports. And then the other issue is you provide really quality services, we know that, but we don't have a way to measure it to tell people that you do quality services. So kind of moving in a direction so we can talk about the great work that we do. I think that that's also going to be forthcoming as well. And then finally, not finally, because there's one more, embracing diversity. It's looking at the fact that here in Colorado, across the country, the one thing to celebrate is we're having a more diverse nation, but the older adults, we have a 217% increase in diversity among the older adult population over the course of the next couple of decades. And ensuring that as we move forward, that our services and supports reflect the people that we're serving, but also that our agencies in the staffing reflect the people that we're serving, and the leaders of our agencies reflect the populations that we're serving as well. And then finally, the workforce challenge issue. And boy, if I could make $1 billion that I would invest right back in the network if I could solve this issue. Truly, it's are we going to get enough people to be able to really see working with the aging population as a career opportunity. So the intern from ACL, I want your card, yay. How do you get all your friends? You should tell all your friends the market for working in aging. But it's direct care workers as well as other professionals. And then also recognizing that many of us will be working well past 60, 65. and we'll be working in our 70s and ensuring that those opportunities are there for us. Some will want to work, and some will need to work. So as we look at the aging network moving forward, as you plan, as you look at your data, I think underlying what I want you to be jazzed up about is the fact that you are a network on the move. What you are doing and the opportunities before you are really cool. And they will make a difference in millions of people's lives, as you already do, but this is an exciting place to be. It can be daunting as well, I get that. Even at our table we're saying, pick 4, you know, but it's something that we need to do. We need to start incrementally. That's how change happens. And we need to start where our sweet spot on the areas that we work really well and we work best. So as we're looking at moving forward, I'm a quote person, I'm sorry, but I really think this is true. The great thing in the world is not so much where we stand, it's the direction we're moving in. So recognize that you have the momentum to move forward, you are moving forward, and just keep building on that. And any, recognize that challenges are just problems waiting for solutions. And in saying that, you're the folks that are going to make this happen. Every single one of you in this room. It is a daunting task, but whether you're in an area agency, whether you're at the state, whether you're at ACL, whether you're at the governor's office or in the commission, you're the ones that are going to make this happen. So it's that quote that, another quote, Lily Tomlin, I was waiting for somebody to solve that problem, and I realized that person was me. That's really the situation that we're all in, is that we have to be leaders for the future of aging. And in saying that, we have to, because all of those people that I showed on that first slide, they're all counting on you. Every single one of them are counting on you. They may not count on you till they're in crisis, but they are still going to count on you, and their caregivers are going to count on you, and more, your neighbors are going to be calling on you, and anybody, as soon as you say aging and you walk into a cocktail party, have you noticed how the conversations change? Because you are the hot commodity moving forward. And finally, my friend Bob. I was so much older then, I'm younger than now. We are, and when you're looking at the opportunities for aging in the future, the opportunities to get rid of ageism and to really focus on not to ignore the challenges of aging, but to realize that the population that we have the privilege to serve has so much to offer, and how can we balance their needs with the vision of valuing them in every community in this country. Even though Bob can't sing that song anymore. So because I saw snow outside, I want you to go forth and ski and have fun, but I also want you to plan for the future, and anything that I can do to help you along that way, I'm happy to. So how did I do on time, Linda? I've got 8 minutes, so I've got 8 minutes for questions.
So one of the things we're trying to do to address this issue of social isolation is a senior companion program. We could not get that funded through Senior Corps because they said we didn't have enough need. So we're doing it. We're doing it. But that when you talk about that $6 billion or $1 million, whatever it was that gets spent to deal with social isolation, this is a perfect example of a way to deal with that.
Absolutely. And what's interesting to me is because of the partnerships we're trying to build with healthcare, let me in on it. Healthcare people see this and are looking at ways to try to fund it. Non-traditional ways to be able to fund it, because they see that dollar and they also don't know how. And that's not something in a 15-minute doctor visit or follow-up that you do. It takes more. It takes what you do. So I think we've got discussions going on in the healthcare arena, and the issue with Senior Corps is they were barely able to hang on with their funding. But they did. So I think we're looking at any avenue we can to be able to help support funding in this arena. I know a lot of the things that I highlighted, and I'm always reluctant to do that because right now there's no new funding for dementia, or there's no new funding for advanced illness or social isolation. So how can we be creative with the partnerships we have and with the funding, and how can we change what we're already doing and just add something else? How can you ensure that your Meals on Wheels volunteers, you know, when they go into the home, maybe ask a couple of questions that target social isolation, and then the next visit, you know, have something to give to that client base, and to engage them. Homebound people are great at telephone reassurance. So, Erin?
Do you see any AAAs or anything at the national level happening to fight ageism?
You know, there's a whole initiative going on to fight ageism. There was a group of aging organizations, and we and the state units on aging weren't part of that, but that did some research and kind of set up some initial trainings. We're looking at ways to be able to take that back into the local, state, and local level. There are some folks that are doing some work in that arena. We had some people who were who presented on that at our annual conference, so I can put you in contact with them.
Changing the narrative.
That's the reframing.
Reframing aging.
So we're,
So that we have that
Colorado
here.
is a participant in
Great.
the Rose Community Foundation, which serves, and that's 50, but Rose, and that's 50. Rose serves the metro area that they recognize in terms of profit marketplace. There's some Colorado-based groups.
Well, and if you can link that in, I mean, because I think that really is part of the equation. You know, I know up there it says social isolation. The other thing is hidden and negative perceptions of older adults. Really, it's, people won't admit it. To me, I would love to get rid of all of those Hallmark cards that we give out that just, you know, when you get to be a certain age, it just, you know, they may be funny, but they also, they're laden with a negative perception of what aging really is.
I just wanted to say that the Frameworks Institute, which is leading that effort, is speaking at our, they're actually the keynote, a researcher from Frameworks is the keynote speaker at our conference in a few weeks, called Doing Well, and I have some cards that I'll hand out. And I know some folks here will be there as presenters or as guests. Can I ask a question?
Sure.
So it's a Medicare question. So with Medicare Advantage is kind of opening up a lot of new
Opportunity, potentially.
benefits
Yeah.
that look very similar, if not identical, to the types of services that are funded through OAA and a lot of state grants too. Can you tell us maybe a little bit about what you're seeing going forward around Medicare policy and OAA, and at the policy level, you know, are there discussions or dialogues around how these two areas might start to look the same, or the role that AAAs might be playing in the Medicare space? You know, our AAA just submitted our Medicare supplier status for the diabetes prevention program. And we're also kind of hedging a little that we'll see more opportunities to build
Move in that direction?
Yeah, to code for Medicare reimbursable services. So I'd just be curious to see, sort of hear what you're seeing at.
What I'm seeing is I am seeing amazing interest on the part of Medicare Advantage providers